Welcome. I am Dr. Thomas Gerber, one of the associate editors of Mayo Clinic Proceedings. In this recording, I will introduce you to the articles that our editor-in-chief, Dr. William Lanier, has chosen to be featured on the cover of the January 2013 print journal. This is as good a time as any to tell you that we have started a Twitter feed. Please follow us on www.twitter.com/Mayo Proceedings so that you can hear about online first publications in Mayo Clinic Proceedings and about newsworthy developments related to our journal. This year's annual January editorial by our editor-in-chief, Dr. William Lanier, is entitled Mayo Clinic Proceedings 2013 Report from a New Vista. In this article, Dr. Lanier will tell you, as only he can, about our current status and future plans for the print journal, website and social media, peer review, and recent metrics and survey results. This month's editor's choice is the original article entitled Effect of Physical Activity on Serum Prostate-Specific Antigen Concentrations, Results from the National Health and Nutrition Examination Survey 2003 and 2006, which was authored by Dr. Paul Loprinzi from Bellarmine University in Louisville, Kentucky, and Dr. Manish Kohli from Mayo Clinic in Rochester, Minnesota. Dr. Kohli is also our section editor for medical oncology. The authors found that individuals who are sedentary or engage only in low-level, light physical activity have higher PSA concentrations than individuals who are more physically active. A video interview with Dr. Loprinzi can be viewed on the homepage of Mayo Clinic Proceedings. The accompanying editorial PSA, Please Stop Agonizing Over Prostate-Specific Antigen Interpretation, was authored by Dr. Derek Raghavan from the Levine Cancer Institute of the Carolinas Healthcare System in Charlotte, North Carolina. The author discusses the recent PSA screening recommendations by the U.S. Preventive Services Task Force and also the possible relationship between physical inactivity and the pathogenesis of prostate cancer. One of this month's features is the original article entitled 30-Year Trends in Outcomes of Percutaneous Coronary Interventions in Diabetic Patients, which was authored by Dr. Mandeep Singh and colleagues from Mayo Clinic in Rochester, Minnesota. The authors find that over 30 years, the improving outcomes in patients with diabetes who underwent percutaneous coronary interventions have been similar to improvements in patients without diabetes. The risk-adjusted association of diabetes with long-term death, myocardial infarction, and stroke has decreased in the current era compared to the era where coronary stenting was used as a bailout approach only after failed balloon angioplasty. The accompanying editorial entitled Treating Coronary Artery Disease in Diabetic Patients with Balloons and Stainless Steel, What is the Role of Percutaneous Coronary Intervention?, was authored by Drs. Joseph Murphy and Thomas Allison from Mayo Clinic in Rochester, Minnesota. The authors point out that an impressive improvement over time in success rates and much lower complication rates for percutaneous coronary intervention have occurred from the earliest days of percutaneous transluminal coronary angioplasty through bare metal stenting to the current era of drug-eluting stents. They also discuss why percutaneous multivessel coronary revascularization is less successful in patients with diabetes than in patients without diabetes. The second featured article this month is a review entitled Idiopathic Inflammatory Myopathies, Current Trends in Pathogenesis, Clinical Features, and Up-to-Date Treatment Recommendations, authored by Drs. Florian Ernst and Anne Reed from Mayo Clinic in Rochester, Minnesota. Based on a comprehensive search of the pertinent literature from 1970 to 2011, the authors review their current management and treatment algorithm for idiopathic inflammatory myopathies including the care of pediatric patients with dermatomyositis. The brief report entitled Successful Implementation of a Telemedicine-Based Counseling Program for High-Risk Patients with Breast Cancer was authored by Dr. Sandhya Pruthi and colleagues from Mayo Clinic in Rochester, Minnesota, and the Alaska Native Medical Center in Anchorage, Alaska. The authors demonstrate the feasibility of a telemedicine program to provide integrated specialty care that resulted in a positive effect on patient satisfaction. The program had a sustainable business model and may represent a new opportunity for healthcare delivery. The original article entitled Increased Incidence of Cutaneous Non-Tuberculous Mycobacterial Infections 1980 to 2009, a population-based study, was authored by Dr. Ashley Wentworth and colleagues from Mayo Clinic in Rochester, Minnesota. Using the Rochester Epidemiology Project data, the authors show that the incidence of skin and soft tissue infections attributable to non-tuberculous mycobacteria has increased nearly threefold between 1980 and 2009. Rapidly growing mycobacteria, such as Mycobacterium fortuitum, were predominant during the past decade. A video interview with Dr. Lisa Draghi, one of the co-authors of this article, can be viewed on the homepage of Mayo Clinic Proceedings. This month's concise review for clinicians is entitled Clinical Pearls in General Internal Medicine 2012 and was authored by Drs. John Bundrick and Scott Litton from Mayo Clinic in Rochester, Minnesota. The authors present 6 short patient vignettes that each are followed by a multiple-choice question and in-depth discussion that ends with a concise clinical pearl. Issues addressed include upper respiratory tract infections, osteoporosis, obstructive sleep apnea, dry eye syndrome, and estimation of stroke risk in patients with atrial fibrillation. The special article entitled The Promise of Lean in Healthcare was authored by Drs. John Toussaint from the ThedaCare Center for Healthcare Value in Appleton, Wisconsin, and Dr. Leonard Berry from Texas A&M University in College Station, Texas. The authors provide a template for healthcare leaders to use when considering the implementation of the so-called lean management system or in assessing the current status of lean implementation in their organizations. They also discuss the nature of lean as a cultural transformation that changes how an organization works. A video interview with Dr. John Toussaint can be viewed on the homepage of Mayo Clinic Proceedings. Please remember that authors or co-authors of 3 of the articles we have discussed, Drs. Loprinzi, Draghi, and Toussaint, have provided video interviews. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. There, you can also find other video interviews related to articles from our January issue, including a message from Dr. William Lanier, our editor-in-chief, and by Dr. Saint Souvet from Mayo Clinic on Why Do Patients Visit Their Doctors? Assessing the most prevalent conditions in a defined U.S. population. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features yours truly, Dr. Thomas Gerber. I am a cardiologist with a joint appointment in radiology from Mayo Clinic in Rochester, Minnesota, who has been an associate editor of Mayo Clinic Proceedings for many years. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the January 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the February 2013 issue of Mayo Clinic Proceedings will contain articles on safety of clopidogrel in hip fracture surgery, a systematic review of the effectiveness of hyperbaric oxygen in the management of chronic diabetic foot ulcers, and care coordination for complex patients in inpatient and outpatient settings. Our February issue will go live on our website on February 1st, 2013. See you then.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.